Hello, good evening. My name is Dr. Chudi of Snowspirations Global Health Solutions. How are you? I hope you had a wonderful day. Today is Tuesday, and today is our popular open clinic in YouTube. And today we're going to talk about ovulation. Ovulation is a very important topic in women's health. Ovulation is very important in fertility management, and becoming pregnant. So today is going to be very interesting. I'm going to take time to kind of guide you through on what ovulation is all about by focusing on the signs and symptoms of ovulation that every woman who intends to become pregnant and become a mother should be conversant with. So, in keeping with this very important topic, I want everyone in the clinic who is ready to please indicate, give me a thumbs up, introduce yourself. So, tell me where you're located, tell me your name. It's going to be interactive. I'm going to take time. If you guys notice, I love this topic because this is the most important topic for any woman that wants to become a mother. You have to understand ovulation appropriately. So I'm going to use my teaching aid to illustrate. So over time, when I'm done with my presentation, you can ask your questions. So I'm going to do justice to your questions. If you don't have access to YouTube, you can join me immediately after this clinic in Facebook. So I'm going to go to our community page and repeat this same topic. So don't worry if you're not in YouTube, just make sure you piggyback to Facebook immediately. So let's talk about ovulation. So I can see 3 people are already standing by. If you know anybody you love so much that probably might benefit from this topic, please extend a hand of fellowship to them. If today is the first day attending my clinic, I truly appreciate you. Thank you so much. To make sure you're kept in the loop of all my important videos, especially reproductive videos, please make sure you share this link. Make sure you click on notifications and make sure you click on subscription. So all you need to do is to click on them. Then subsequently, when I come live, it will notify you. Okay, now to learn when you have the most fertile period and ovulation symptoms and signs, it's important you pay attention. So if you are getting ready to grow your family, learning more about conception, you have to be familiar with ovulation. Ovulation is at the center of all pregnancies. Without ovulation, you cannot become pregnant. Just like without the sperm, you cannot become pregnant. Whether it's natural, whether it's assistance, ovulation must be there for pregnancy to happen. So exactly when you ovulate varies. It's not constant, even in a woman. So there are some women that might actually be lucky and blessed to recognize the signs. So it's actually the signs that we're going to talk about today. Because once you recognize that signs, you can begin to practice more during that period, which is your fertility window. So, but there is a condition. You have to have a regular predictive cycle before you can begin to practice all those timed lovemaking. We don't preach timed lovemaking in our group. We preach every other day lovemaking. So even if you are not believing to become pregnant right now, it's important to know all this for the future. So not only can it help you to understand your menstrual cycle, help you to identify the normal from the abnormal, it will help you down the road. Like some women can actually track their ovulation pattern, and if they have a regular period, they can actually avoid pregnancy, though it's not reliable. So there are so many things you can gain from learning about ovulation. So the big question is, when do you ovulate? Now, this is something I have to review because you are probably wondering, like, oh, when exactly do I ovulate? You may have heard that typically it will happen on day 14 on a 28-day cycle. Guess what? This is for women that have a 28-day cycle. 28-day cycle is the commonest cycle for majority of women there. So if you bleed every 28 days, your ovulation by the special grace of God will happen on day 14. That's if it's regular, if it's predictive, then in a 28-day cycle, ovulation is the middle. Now, as a constant, the last 14 days in a woman's cycle is constant. So ovulation from our research will always happen from the last 14 days before you bleed again. So in this woman that have 28-day cycle, that 14 days actually coincides with the period you're gonna bleed again. So 28-day cycle is the constant. However, women can have a variation of from 21-day cycle to 35-day cycle. So, your period can actually also last between 28 to 32. And in some cases, we can have variations on the days you will ovulate. So your ovulation day can be on day 10, it can be on day 11 up to day 21 based on your constant. So in a healthy woman who has a regular predictive cycle, it's expected that your ovulation will happen on day 14. Now, if you happen to have 35-day cycle, your ovulation will happen on day 21. Considering that the last 14 days is constant, so the last 2 weeks before you bleed again is constant, that's the time to target. So if it's regular for you, that's the time you will fall into your fertility window. Your fertility window is that period of 5 days before your ovulation and a day after your ovulation. That's the best time for a woman to become pregnant if everything is constant. So this is why it's a good idea to be familiar with your body cycle, with your calendar, so that we can know when things go normal and when things go abnormal. Now, some women might actually not be ovulating. So ovulation doesn't always take place. Some women can have skipped ovulation. This month they will ovulate, next month they won't ovulate, and some women will not even ovulate. So it's important we pay attention to your pattern. Now, there are some conditions that when you have them, you cannot ovulate. Pregnancy. When pregnancy happens, it's expected your whole hormonal switch will happen. Ovulation will not occur. When you enter menopause, you will no longer ovulate because you no longer have eggs. When you're using birth control pills will go to your ovaries and tell your ovaries, you know what? I don't want you to release eggs for me. So these are the conditions that will lead you not to ovulate. Now, you might also have some medical problems like polycystic ovarian syndrome, like premature ovarian failure, or you're some medications like antidepressant medication, medications for vomiting, medications for treating cancers. These are all medications that can actually stop you from ovulating. Your lifestyle, if you are going through a lot of stress, and if you're underweight or overweight, which will use your body fat to measure, they can affect your ability to ovulate. If you're dealing with irregular cycle, or the one that is particularly short, so short cycle is cycle of 21 days and below. Long cycle is cycle of 35 days and above. We recommend you get evaluated by a gynecologist. So it's true that when you track your ovulation, if you're having irregular cycle, it can be difficult. But bear in mind, the last 14 days is constant. The last 14 days to your next bleeding is constant. So can you take a moment and think about that? If it's possible for you to track your cycle, your bleeding from January, you will notice a pattern. So long as you don't have all the conditions I've mentioned, no polycystic ovarian syndrome, you're not using all those medications, you don't have overweight, you don't have underweight, you're not treating cancer, your last 14 days will be constant. So whether you have 35 days, whether you have 30 days, the last 14 days, if you pay attention, will coincide to the period you will ovulate. Now, if you are currently a new mother, you have a new baby, and you're planning to breastfeed that baby exclusively. Exclusively means you can only give that baby breast milk. You might have some passive protection from ovulation happening because the hormones that maintain breastfeeding, which is prolactin, doesn't like ovulation. So once you have a higher level of prolactin in your body and it's helping you to produce milk you give your baby, it can protect you. But any moment you introduce any formula, it can disrupt your hormone and ovulation can happen and you can become pregnant. This is why we preach before you go home as a new mother, please use reliable contraceptives. Now, I've already asked, How long does ovulation last? I'm not going to waste most of your time, just within 24 hours. So if you're wondering, oh, how many days do women ovulate? Just 1 day. And guess what? This is the only day you can become pregnant. So once the egg is released from the surface of the ovary, it can potentially be fertilized just in about 24 hours. So if you have not had sex on the exact day of your ovulation, you can still become pregnant. This is where the power of the sperm can come in. The sperm deposited in the vagina can still be valid up to 5 days before your ovulation. So you must not make love on the ovulation day to become pregnant. Any other day you make love in the 6 days of your fertility window, remember 5 days before ovulation, a day after ovulation is your fertility window. You can become pregnant. Now, beyond 24 hours, when you release your eggs, those eggs will no longer be viable. They will typically disintegrate, and it will be part of what will pass through your body as part of your bleeding in your next cycle. So let's talk about the symptoms, which is the major reason why I convened this clinic today. What are those classical ovulation signs you should look out for? Now, you're probably wondering, can you feel ovulation happening? And at what exactly time do you begin to feel this? What exactly does ovulation feel like? Now, it's not constant. It can differ from woman to woman, but there are several common ovulation signs you can sense in your body if you pay attention. Some women can have it before, some men can have it during ovulation because of hormonal shift, which can affect your entire body. And when it affects your entire body, your body can present differently. So women can actually do this, use these symptoms to be a powerful tool that can help them to know when they are ovulating. Many women will experience all these symptoms up to 5 days before ovulation, and some will even experience it a couple of days after ovulation. So if you don't notice any of these signs, don't think you're not ovulating. The fact you have all these signs is not diagnostic. It doesn't mean yes, you are ovulating. You can have all those signs, you are ovulating, or you might not ovulating. If you don't have it, you might still be ovulating. So we want you to just go easy. So if you don't have any of the signs I'm gonna mention, it doesn't mean you're not ovulating. Don't worry, it can still happen. Most women will not even have clues of everything I'm talking about, but it doesn't matter. So let's talk about the symptoms. We have a lot to talk about it. Now, the very first symptom, which I want every woman to be conversant with, starting from today, increase in your cervical egg white mucus. This is your cervix. The cervix is the junction between the vagina and the womb. Now, during ovulation, there are some cervical mucus changes that happen. This is one of the commonest signs and experience that majority of women will have. As you are getting nearer to your ovulation, your body will begin to produce more estrogen. When it produces more estrogen, estrogen will go and cause cervical mucus to begin to increase and become stretchy and clear like egg whites. The essence of becoming stretchy, clear, and egg white is to specifically allow the sperm to swing through the cervix so that the sperm can enter the womb. So cervical mucus changes can happen in most women. So you need to know what you're looking for. The amount of cervical mucus and what it feels like can also vary. Now, if you haven't checked yourself, you can actually check yourself tonight. To test for this, insert a clean finger in your vagina, clean finger. Now remove the mucus from the cervix. Remembering that if you go deeper, the junction, you will feel some, rough edges. The junction between the womb and the vagina is the cervix. Now, if you stick your clean finger into your vagina, you will remove it. Then you test it between your thumb and this first finger. You will feel it stretch. If you notice it's sticky, stretchy, or very wet and slippery, that's a sign you might be ovulating. So the first sign is what? Changes in cervical mucus. This is commoner for most women. Number two, when you are about to ovulate, you will notice changes in your senses, especially the sense of smell. When women that are paying attention to themselves notice this, at that particular time, you have increased sense of smell. Anything good, bad, very bad odor, you can pick it. This is likely a sign you might be ovulating. And in this fertile phase, your body is already primed so that you can be attracted to your opposite sex based on what we call pheromones. So based on this increased sense of smell, you can easily, if you have a good relationship with your partner, you can perceive your partner's pheromone. So pheromones are like aphrodisiac. It's a kind of androstenone, a kind of male hormone that males will elaborate that will attract women. The same thing that happened in animal kingdom. If a female is in heat in animal kingdom, the male animal will figure out that that lady is about to mate, and they will mate, and the female animal will become pregnant. So heightened sense of smell, and some women will also notice heightened sense of taste. Now, number 3, this is also common. Majority of women will feel soreness or tenderness in their breast. So just as you're about to enter ovulation, if your partner places his hand on the nipple, or you place your hand on the nipple, you're taking your rubbing cream, you will notice that your nipples area are sore. This is a sign you might be ovulating. Now, it's also due to the hormones, the estrogens that go up and down. Some women will also notice tenderness before ovulation. Tenderness means when you touch something, you will feel some pain. This might be a cardinal sign you are ovulating. Some women will have mid, pelvic, or lower abdominal pain. We call it mid-cycle pain. A lot of women wonder, can you feel ovulation? Yes. For some women, the answer is actually yes. Typically, a mild, dull pain on the lower abdomen, usually on one side. I want you to pay attention. Remember, you have 2 ovaries. So if you're feeling this sign on the right side, and you know it's constant, you are likely ovulating from the right side. If next month you begin to feel it on the left side, you are likely ovulating from the left side. You are not supposed to feel it on both sides. It should be more predominantly on one side. This is called ovulation pain. It can be sharp, it can be dull, cramp, it can be on just one side of your body. This is a side effect in some women, and it can last between few minutes and few hours. Now, you might also experience vaginal bleeding, discharge, feeling like you want to vomit, which I'm still going to talk about. If your ovulation pain is really significant, you can take over-the-counter medication, paracetamol, ibuprofen, and you will feel fine. But if you notice that this pain is actually increased, at that time you feel you're ovulating, please make sure you follow up with your doctor. You might likely have some gynecological problems. But ovulation pain is very, very important. Now, some women might ask, since I noticed this pain about the time I'm ovulating, is it a good sign that my fertility is good? The answer is yes. Because if everything is constant and the egg is there, the sperm is there, if you notice this sign, then if you make love about this time, you're going to get pregnant. Number 5, I've already mentioned that some women will have light spotting and discharge when they are ovulating. The discharge is more like brown discharge or spotting. The ovulation symptoms will happen. This is happening because, remember, the egg is in the follicles. So by the time the egg is coming out, when the egg is breaking through the follicles, it will kind of, rupture and result in small amount of bleeding. So those type of bleeding you will see there is because the egg was forcing through the follicles, and as the blood is getting older, it will turn brown. So if you have brown discharge or spotting about the time you're ovulating, completely normal. You don't need to freak about it, okay? Now, some women will notice increase in libido. Increase in libido means you will have a desire to make love more with your partner. This is also a sign you might be ovulating. God made it this way. So some women will notice that their sex drive will go up during ovulation, which might be Mother Nature telling the woman it's about time to make babies. So this is unique for some women. Now, remember, there are some other things that can also influence your ability to make love. Wine, good mood, and all that. But increase in your libido about the time you're ovulating is also a constant sign. Now, some women will notice changes in the cervix. So if you're conversant with your cervix, which to get to their cervix, clean finger, pass through the vagina, then you will get to the junction. Now, when you are ovulating, you will notice that your cervix will be higher, softer, and more open. This is also a design by God to allow men and women to meet together so that pregnancy can happen. So there are a couple of changes you will see in the cervix during ovulation. Now, some women can also have headaches. Some women can also vomit. Some women can also feel very tired about the time they are ovulating. It's also normal in some women. Now, some women will also notice, if you pay attention, about the time you are ovulating, there is a little rise in your body temperature. It's called increase in basal body temperature. It can happen to some women. So these are the classical signs and symptoms in some women that will tell them they are ovulating. And once you have this, you're in a good place, and by the special grace of God, if other factors are okay, you become pregnant. So this is my presentation, and I'll give you an opportunity to ask your questions. So please start asking your questions. I can only see one person. Chinenye Echebiri. Thank you. You're calling from Abuja. It's time for questions. Start asking your questions. I can see 8 people, but it's only one person that introduced herself. But please, you have an opportunity to ask your questions now. This is the most important topic in women's health. So I'm going to give you a few minutes. If you have any questions, feel free. I'll take you through. I'll give you feedbacks. Then we transition to Facebook for the second clinic. So start asking your questions. Unfortunately, admin is not in attendance today, but anytime admin comes back, admin will help you to address any issues. But for now, ask your questions. I'm going to give 1 minute. After 1 minute, if we don't have any questions, then I'm going to end the clinic. Ask your questions. Okay. Thank you for coming. The next clinic will be on Saturday. So our YouTube clinics are Tuesdays and Saturdays. So Tuesdays, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. Then on Saturdays, we come a little bit early, which is about 12:30 p.m. Eastern Time. Sometimes it might be 1 p.m., but most likely 1 p.m. So, but whatever happens, we're going to communicate with you guys. So I think I have one question from Chinenye. When feeling the ovulation pain, does it mean that the egg has been released? It's not like a constant. The ovulation pain you are feeling, it's because as at the time the egg is bursting, they are going through the follicles, and just that movement of the eggs from the follicle, from that side of the ovary, can elicit pain. That's if everything is constant, right? It doesn't mean that, oh, once you feel this, the egg has been released. If everything in your body is constant, hormones okay, body weight okay, if you notice that this pain, it's on the left side this month, is on the right side that month, if every other factor is constant, you have ovulated, especially if you have a regular cycle. That's the criteria. Okay? All right. Thank you so much. I'll see you guys again on Saturday. Until I see you, remember to share this video. Remember to subscribe to our community. Remember to get involved, ask questions if you don't understand. And if you're in our Facebook, just give me a few minutes. I will go back to Facebook and I'll repeat this same topic. Thank you so much for coming. God bless you and bye-bye.